Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. You are watching a COVID-19 World News coming to you from Houston, Texas. Today we are going to be talking about the CDC guidelines for vaccination for all occasions. This was published on January 21, 2021. So we're going to go in detail about the entire vaccination process in multiple scenarios. So sit back, get a cup of coffee, relax, and enjoy the presentation. Before I begin with the feature presentation, I would like you to take a look at my COVID-19 pandemic, an international guide on Amazon.com. While you're there, you might also check my other publications. So let us begin with the feature presentation. As most of you are aware that there are two main vaccines that have been approved, namely the Pfizer-BioNTech and Moderna vaccine, and Johnson & Johnson may be in the pipeline to be approved in the early weeks of February. Of course, we also have the AstraZeneca vaccine, which has been approved in UK and in Europe. The first thing is Pfizer-BioNTech is recommended for people over the age of 16, whereas Moderna is recommended for people over the age of 18. The second point I would like to make out is that the Pfizer-BioNTech has 30 micrograms of the active ingredient, which is the messenger RNA COVID vaccine, and it has to be given 21 days apart, which most of you are familiar with. And Moderna has 100 micrograms given 28 days apart, 2 doses. The quantity of the vaccine doesn't really have a significance as far as the outcomes or the results are concerned. While we are talking about the outcomes or results here, the preliminary data suggests that Pfizer-BioNTech vaccine has a 95% efficacy in terms of preventing serious COVID infection 2 weeks or 1 week after the second dose. Similarly, Moderna has shown 94.1% protection against the SARS-CoV-2 infection 1 week after the second dose. There's very limited data available as far as the efficacy of the single dose. There are some studies which suggest that there may be some protection. In the previous video I did on COVID update, I mentioned these things. You're welcome to watch that video for a detailed description of what percentage of the population is covered after the first dose. For example, in case of Pfizer-BioNTech, the protection was only approximately 52%, whereas in case of Moderna, the protection was close to like 68%. In fact, in Israel, they looked at the people who had received the first dose of a vaccine, and they found out that after 18 days following the first dose of vaccine, they had 62% protection against symptomatic infection or hospitalization. More data will be coming as we wait, and maybe it will shed some light as to how effective a single dose is, because there are some circumstances where people may not be able to take the second dose because of allergic reactions or anaphylactic reactions, and in those circumstances we have to make a decision as to what is the next appropriate step. The next point is these two vaccines are not interchangeable according to the CDC guidelines. The safety and the efficacy of mixed product series has not been evaluated or established, and hence if you receive the Pfizer, you probably need to receive the Pfizer vaccine unless you have an anaphylactic reaction, in which case your physician recommends you not to take that particular brand. And in rare cases, I have seen in the literature where they have been able to use a different brand like Moderna or even the AstraZeneca, which is a different kind of product, namely it is through the adenovirus. But those are exceptional cases, and they can only be decided by your primary care specialist, and also the allergy immunology specialists who can determine how well you'll be able to stand the second dose. It is not for the faint-hearted people. Once you receive the first vaccine, of course, you get a card, and that card can easily be duplicated. But nonetheless, I think there has to be a much better way of keeping your record, not only for the current situation, but in the future, if you need it for employment, for airlines, for any other purposes. In fact, I did a video on vaccine digital passport. You can take a look at that. We extensively study the effect of a vaccine and how people can maintain electronic records that are internationally acceptable. Anyway, you can also sign up with this Vax Text SM, which is an app where they can message you when you're due for your second dose of the COVID vaccine. Your data can also be entered into the vaccine recipient's vaccination in the immunization information system. This is a national system, so that at least you have some record which may be tapped by airlines, for example. And so you need to have some kind of a confirmation as to how reliable the piece of paper you're showing or the digital format. I came up with a great concept of creating a QR or a barcode which can be saved as an image, which not only has your full name as it appears on your passport or the ticket, it also has your date of birth, it has your location, it has the date you received the vaccine and the type of vaccine or vaccines you have received, so that it ties up with your biodata on the airline's computers and also on your credit cards, so that there's a sort of a 2 or 3 step authentication of your vaccine records. Co-administration of COVID vaccine with other vaccines, especially if you work in a healthcare environment, you may be required to receive hepatitis vaccine, or if you are injured and you need a tetanus toxoid vaccine. The CDC recommends there should be 14 days of time period between the COVID vaccine and any other needed vaccines for your employment purposes or for medical reasons. However, in case of an emergency, your physician and your experts have to make the decision, but these are general guidelines which apply to general population. Usually, if you have an issue, the best person to answer this would be your primary care doctor in consultation with the specialist, especially where allergy or reactions are concerned. Booster doses. And we have seen people getting COVID infection after the second dose, after the first dose, and there have been questions about whether these people should be receiving booster doses of COVID vaccine. In fact, I did a video on both UK variant COVID infection and South African variant infection, both of which you can watch on my YouTube channel. In fact, when they were testing for the South African variant, Moderna found out there was a 6-fold decrease in its ability to neutralize the virus. As a result, they were even looking into doing a research as administering a third dose to prevent people from getting the South African variant of the coronavirus, even though the titers that were there were adequate enough to suppress the South African variant coronavirus. Now let's talk about vaccination of persons who had COVID infection or who have been exposed to people with a history of COVID infection. Data from the clinical trials indicate that messenger RNA COVID vaccines can safely be given to persons with evidence of prior SARS-CoV-2 infection. Vaccination should be performed to persons regardless of the history of a symptomatic or asymptomatic COVID infection. Vaccine testing to assess acute SARS-CoV-2 infection or serological testing prior to the administration of the vaccine is not recommended. Whenever you encounter a person with a COVID infection, you want to make sure that the person has recovered from the acute illness and have met the criteria for discontinuation of the isolation. This also applies to people who received the first dose of COVID vaccine, then they get the infection. So the recommendation here is to wait until all your symptoms have subsided, until you're no longer able to transmit the disease, and make sure you have no fever. At that time, you should be able to receive the second dose. What about people with the current or prior history of SARS-CoV-2? While there is no recommended minimum interval between infection and vaccination, current evidence suggests that the risk of COVID-2 reinfection is low in months after the initial infection, but may increase with the time due to waning immunity. So that means if you had a COVID infection recently, you are supposed to have immunity for at least 3 to 4 months. So there is no urgency in receiving the COVID vaccine. This is especially true when the COVID vaccine supplies are limited, unless you happen to be working in a healthcare environment and your employer feels it is safe for you to receive the vaccine. That depends upon each institution. Let's talk about people who have received antibodies. As we know, there are monoclonal antibodies to treat, as in an outpatient setting, the early onset of COVID patients. And what do? These antibodies are supposed to be circulating in the body, and according to the studies, it has been shown that their half-life is approximately like 90 days. So the CDC recommendation is to wait for 90 days if they receive any type of monoclonal antibody as a treatment for their early detection of a COVID-19 infection. Persons who receive passive antibodies. Again, these are people who have received intravenous immunoglobulins or who have received plasma transfusion, may fall into the same category because they have antibodies. These antibodies are supposed to last for approximately 3 to 4 months, and hence there is no urgency in getting a vaccine for these patients. Messenger RNA vaccines are not currently recommended for outbreak management or for post-exposure prophylaxis. I'm talking about prophylaxis. However, persons in the community or outpatient setting who have had a known COVID exposure should not seek vaccination until their quarantine period has ended, to avoid potentially exposing other healthcare workers to COVID infection during their visit. Persons working in congregate settings like healthcare workers and nursing homes who have had an exposure or waiting for the results of the COVID test, and those who do not have symptoms can receive the vaccine. This is contradicting a little bit the earlier statement, people who have been exposed to the COVID should not be receiving the vaccine. But we have to understand the risk-benefit ratio. If a person working in a nursing home is a risk to himself or herself and to others, same way with the healthcare workers, if the risk is high, then I think it's reasonable to consider providing the vaccine for these groups of people. Let's talk about vaccination of people with underlying medical conditions who have immune compromised system, persons with autoimmune conditions, persons with history of Guillain-Barré syndrome, persons with history of Bell's palsy, that is a paralysis of the one side of the face or the other, persons with history of dermal filler use, because some of these materials are used in the vaccine and they can have an allergic reaction to that. Anyway, we are looking at people with compromised immune system or people who already had symptoms related to other viral illnesses like Guillain-Barré syndrome or Bell's palsy. In these conditions, I think the best decision can be made by your primary care doctor in consultation with the experts in immunology, allergy, and other viral diseases, because this is beyond the scope of walking into a mega vaccination booth and getting your vaccine if you are having one of these conditions, versus visiting your primary care doctor, visiting your specialist who can arrange for you to have, with the knowledge that you have this immune compromised system, that they have all the facilities to deal with an anaphylactic reaction in case you just develop one. All right, vaccination of pregnant and lactating persons. There is no safety data available as far as vaccination of pregnant women are concerned. However, there are many people who work in the emergency rooms, who work in the medical intensive care units. I'm talking about healthcare workers who may be pregnant. And in these circumstances, they feel your obstetrician and your primary care doctor have to get together and decide what is best, what is in your best interest. And they say there's no recommendation for routine pregnancy testing before receiving the COVID-19 vaccine. And those who are trying to become pregnant do not need to avoid pregnancy after COVID vaccination. Lactating mothers. There's no data on the safety of a COVID-19 vaccine in lactating mothers, or the effects of messenger RNA vaccines on the breastfed infant or milk production or excretion. Vaccine efficacy. Severe allergic reactions after a previous dose of a messenger RNA vaccine or any one of its components, or if they have an immediate allergic reaction of any severity to a previous dose of a vaccine or its components, including polyethylene glycol or PEG, or people with the immediate allergic reaction to any severity to polysorbate. These are all some of the ingredients that are in the vaccine. That's why they are bringing up these things. These persons should not receive messenger RNA vaccination. As I told you, they contain this polyethylene glycol. They also contain polysorbate as substrates in the vaccine composition. Any vaccine adverse reaction has to be reported to FDA under EUA guidelines to VAERS site. Here's the address for this site and the phone number. Anybody who has vaccine administration errors or omissions, serious adverse events, cases of multi-system inflammatory syndrome, cases of COVID-19 that results in hospitalization or death. And all of these are followed not only by the FDA, but also by the manufacturers very closely to understand the mechanisms of these allergic reactions or deaths. Any other clinical adverse reaction that is not covered under these should also be reported. Ladies and gentlemen, this has been a summary of the CDC guidelines for vaccine administration for all occasions, which was reported on January 21, 2021. I am Dr. NIK NIKAM. You have been watching the COVID-19 World News. Before I conclude, I would like you to again take a look at my COVID-19 Pandemic, an international guide. It's available on Amazon.com. And you have been watching Triple N News. I am Dr. NIK NIKAM from Houston, Texas. Please do subscribe to our channel. We have more than 75 videos on COVID-19 pandemic educational series. Take a look at them and we'll see you next time.